Hello and welcome to this online presentation hosted by Paramedical Services on diabetes mellitus. What we'll be covering off on today is how blood glucose is regulated with use of the pancreas and the liver. Then we'll watch a short educational video on diabetes. We'll discuss diabetes type 1 and type 2. Then we'll discuss the medical emergencies which result from diabetes, such as hypoglycemia and hyperglycemia with diabetic ketone acidosis. We'll have a look at the signs and symptoms of these medical emergencies and discuss how to treat them in the pre-hospital setting. The pancreas plays a vital role in absorption and the use of carbohydrates, fats, and proteins. It's a chief regulator of the blood sugar levels or blood glucose levels. A healthy pancreas has both exocrine and endocrine functions. The exocrine portion consists of the acini glands that produce pancreatic juices involved in digestion. And the endocrine portion consists of the pancreatic islets, or they're called islets of Langerhans, that produce hormones such as insulin and glucagon. Insulin is produced by the beta cells of the pancreas, and when blood glucose levels rise too high, insulin is released and it aids in transportation of glucose from the bloodstream into the cell. It also aids in metabolism of the glucose by the cell, and any excess glucose in the bloodstream, it helps to convert that glucose into glycogen, which can be stored in the liver. Glucagon is a protein which is released by the alpha cells of the pancreas. When blood sugar levels fall, glucagon is released by the pancreas. Glucagon stimulates glycogen, which is stored sugar in the liver, to break down to glucose, which can be readily available to be used by the body's cells. The other effect of glucagon is to stimulate gluconeogenesis. This is the formation of glucose from breaking down fats and fatty acids. On the diagram, we'll see the homeostatic balances that take place in order to ensure that normal blood glucose level remain within a certain range limit. We'll first have a look at what happens when there's an imbalance when blood glucose levels raise too high. So let's say, for example, somebody's eaten a nice big slab of chocolate. The blood glucose levels start to increase inside the bloodstream. The pancreas reacts to these high blood glucose levels by releasing the hormone insulin. Insulin then stimulates glucose to be taken up and metabolized by the cells, but it also stimulates any excess glucose in the bloodstream to form glycogen to be stored in the liver. And this makes sure that blood glucose levels return back to normal. Now, having a look at the opposite scenario, say if somebody has skipped a meal, skipped lunch, and their blood glucose levels start to drop, the pancreas then goes and releases glucagon. Glucagon stimulates the glycogen that's stored in the liver to break down to glucose, which is released into the bloodstream to increase the blood glucose levels to a normal range. I'm now going to play for you a video on diabetes by Diabetes UK.
In this film, we're going to explain how your body processes the food you eat in order to provide all your body cells with the energy they need. And also what happens when you have diabetes and this system doesn't work properly. When you eat food that contains carbohydrate, it's broken down in the stomach and digestive system into glucose, which is a type of sugar. We need glucose from food because that's what gives us energy. Carbohydrate-containing foods are things like starchy foods, sugary foods, milk and some dairy products, and fruit. This glucose then moves into the bloodstream, and the body detects that the blood glucose level is rising. In response to that, the pancreas, which is a little gland that sits just underneath the stomach, starts to release a hormone called insulin. And it's insulin that helps our body get the energy from the food we eat. The bloodstream then takes the glucose and the insulin to every cell in our body that needs it. To make this easier to understand, let's look at muscle cells. At the muscle cells, it's insulin that allows the glucose to get into the cells where it can be used for energy. It's a bit like insulin as a key unlocking the door to the cells so the glucose can get in. That way, the blood glucose level starts to drop. But the blood glucose level can be topped up at any point by the liver releasing extra glucose that it has stored. The blood glucose rises again, and again the pancreas produces more insulin to move with that glucose through the bloodstream to the muscle cells, open the doors and let the glucose in. The body functions best with the blood glucose at an optimum level. It doesn't like it if the blood glucose rises too high. Normally, there's a cycle within the body which balances out the glucose and the insulin level, and this is achieved by the food you eat, the pancreas, and the liver. However, in some people, the system doesn't work properly and they develop diabetes. There are two main types of diabetes, type 1 and type 2. In type 1 diabetes, the body isn't making any insulin at all. This is because of an autoimmune response whereby the body has destroyed the insulin-producing cells in the pancreas. We don't entirely know why that happens in some people and not in others. Type 1 diabetes accounts for about 10% of all cases. It's most often found in the under 40s, and it's by far the most common type of diabetes found in childhood. In type 1 diabetes, the carbohydrate containing food is broken down into glucose as normal. That glucose then moves into the bloodstream. Normally, the body would produce insulin to let that glucose into the cells, but in type 1 diabetes, there is no insulin being produced, so the glucose can't get into the body cells at all. So the level of glucose in the blood rises and rises. The body tries to lower the level of glucose, it tries to get rid of the glucose through the kidneys. That's why people who have undiagnosed type 1 diabetes tend to go to the toilet a lot to pass urine. As the kidneys filter the glucose out of the blood, they also take a lot of water with it. So the person with diabetes will get very thirsty. The urine contains a lot of glucose, and that creates an environment where it's quite easy for bacteria to thrive. So it's also quite common to get thrush or genital itching. In the same way, the blood contains a high level of glucose as well. So more bacteria than usual will tend to breed in flesh wounds, and they might be slow to heal. Glucose can also build up in the lens at the front of the eye, causing the liquid in the lens to become cloudy. That can mean that some people with undiagnosed type 1 diabetes can have blurred vision. Because the glucose can't get into the cells to be used for energy, somebody who's got undiagnosed type 1 diabetes is going to start feeling very tired, lethargic, and unable to sort of go about their normal daily routine. But the body still needs an energy source in order to work properly. So what it does is it starts to break down its fat stores, and that can lead to weight loss. So the main symptoms of type 1 diabetes are going to the toilet a lot, thirst, thrush or genital itching, slow healing of wounds, blurred vision, tiredness and weight loss. These symptoms generally happen quite quickly, often over a few weeks, and can be reversed once the diabetes is treated with insulin. Type 2 diabetes accounts for about 90% of all cases in the population. It's most common in the over 40 age group in the white population and in the over 25 age group in the South Asian population. Type 2 diabetes is a little more complex because there's slightly more processes at work. Either the body isn't producing quite enough insulin, or the insulin it is producing isn't working properly. That can be due to being overweight because a build-up of fat can stop insulin doing its job properly, but it can also happen in people of a healthy weight. So in type 2 diabetes, the carbohydrate containing food is broken down into glucose in the stomach and digestive system as normal. That glucose then moves into the bloodstream. The pancreas starts to produce insulin, which moves with the glucose through the bloodstream to all the body cells which need glucose for energy. However, The glucose can't always get into the cells because the locks to the cell doors have become furred up with fat deposits. That means that the insulin can't open the cell doors properly. So the level of glucose in the blood continues to rise. In response to this, the pancreas produces even more insulin. So the blood glucose levels continue to rise and the insulin levels continue to rise. This situation is further complicated by the cells, which are desperate for energy, sending out emergency signals to the liver to release stored glucose. The blood glucose level goes up and up, and the pancreas produces more and more insulin until it can't cope anymore, and eventually it can wear out. As with type 1 diabetes, the symptoms of type 2 diabetes are going to the toilet a lot, thirst, thrush or genital itching, slow healing of wounds, blurred vision, tiredness and weight loss in some people. The symptoms for type 2 diabetes come along very slowly, and some people don't have any symptoms at all. So for that reason, people can live with type 2 diabetes for up to 10 years before they realise that they have it. Type 2 diabetes can be treated in a number of different ways. Initially, it may be sufficient to make changes to the food you're eating and to take extra physical activity or lose any weight that may be appropriate. But type 2 diabetes is a progressive condition and most people will need some form of medication to treat it.
Just as a recap from that educational video, diabetes mellitus is a systematic disease of the endocrine system characterized by deficiency of insulin or an inability of the body to respond to insulin. This results in an imbalance in the blood glucose levels, which can lead to medical emergencies if not managed correctly. Signs and symptoms of type 1 and type 2 diabetes is increased intake of fluids, or it's called polydipsia, weight loss, dizziness, blurred vision, polyuria, so going to the toilet a lot, glucoseuria, glucose in the urine, and fatigue or tiredness. Type 1 diabetes. This is an autoimmune disease where the body attacks the beta cells of the pancreas and destroy them, so no insulin is produced at all. And type 1 diabetes only makes up 10% of all diabetics worldwide. It may occur at any time after birth, but it usually presents in teenage years and in young adults. It requires a lifelong treatment with insulin injections, exercise, and diet regulation. Down here we have a picture of one of the newer models or later technologies when it comes to monitoring blood sugar levels and releasing insulin. This is an insulin pump over here. On one side, you have a port that is attached by a needle into the abdomen. It actually monitors the blood sugar levels and it transmits the information to the pump. Then the pump calculates how much insulin should be administered to the person, and it administers the insulin via the injector port into the subcutaneous tissue. These are the non-automated insulin pens. And it's very important that patients with type 1 diabetes very carefully calculate how much insulin to give themselves. This is based on what they've eaten that day and how much physical exercise they've undergone. They then calculate the amount of insulin that needs to be administered. They dial the amount into the pen and inject into the subcutaneous tissue in the abdomen. With type 2 diabetes mellitus, this is characterized by a decrease in production of insulin by the pancreas, or the body's tissues become insensitive to insulin. 90% of all diabetics have type 2 diabetes, which is called lifestyle diabetes. Most patients require oral hypoglycemic medications or insulin, exercise and dietary regulation. Type 2 diabetes used to be called adult onset diabetes, whereas type 1 used to be called juvenile or childhood diabetes, because type 1 diabetes was only seen in younger populations and type 2 was only seen in older populations. However, the disease demographics are changing because of the high intake of sugar in Western introduced diets, where they're noticing that children before the ages of 10 in places like the United States are already undergoing treatment for type 2 diabetes. Type 2 diabetes is a lifestyle disease. It has been related to things such as high blood pressure, smoking, sedentary lifestyles with limited exercise, overweight and obese patients, and high fat and cholesterol levels, as well as increased intake in sugar into the diet. In 2017, it's predicted that 1 in every 3 Americans will have type 2 diabetes. This is an alarming prediction, considering that this is a preventable disease and it can be managed very simply by just changes in diet. When assessing the diabetic patient, conduct primary and secondary assessments. History is key, so ask your sample history, and in the next slide we'll discuss a few other questions that might be important to ask in the diabetic patient. Check blood glucose levels by doing a blood glucose test using a glucometer, and be alert for things such as medical alert information, presence of insulin syringes or insulin pumps, and if in a patient's house, check the refrigerator because some diabetic medications are kept there. A diabetic emergency may mimic other conditions as well, so ensure that you're taking in the whole clinical picture of the patient and ensure that you're getting really thorough sample history and asking further history questions to differentiate between the different disorders. Important components of a diabetic patient's history include onset of symptoms, food intake for the day, insulin or oral hypoglycemic medications. We need to ask, did the patient take their medications today? Did they take appropriate doses? Check the expiry dates. Ask about alcohol or drug consumption because this can alter a blood glucose level. Also ask about any predisposing factors, so if the patient has been exercising, if there's been the presence of an infection or an illness, or if the patient has been undergoing any stress, because these can also all alter the blood glucose level. Under normal conditions, the body maintains a blood glucose level of between 4 and 7 millimoles per liter. There are 2 life-threatening conditions that may result from diabetes mellitus. One is hypoglycemia, that means low blood sugar levels. It is also known as insulin shock because of some of the signs and symptoms mimic that of shock. And the other condition is hyperglycemia, so high blood glucose levels, which can lead to a life-threatening condition called diabetic ketoacidosis, or otherwise known as DKA. Hypoglycemia, meaning low blood sugar levels, is a syndrome related to blood glucose levels of less than 3 millimoles per liter in adults and 4 millimoles per liter in pediatrics. Signs and symptoms usually come on at about the level of 3 millimoles per liter, or signs and symptoms can occur at slightly higher blood glucose level if the fall has been rapid. It may also occur in non-diabetic patients. So if a person woke up in the morning and they were rushing to work, didn't eat breakfast, by the time lunchtime came, they could start showing mild signs and symptoms of hypoglycemia. So this can happen to anybody. The causes of hypoglycemia are usually a result of skipped meals, taking too much insulin or hypoglycemic medication, infections, and increase in physical activity. Signs and symptoms of hypoglycemia include headache, blurred vision, a decreased level of consciousness, changes in mood, sweating, and you may find that there's a history of a skipped meal. The aim of management in the hypoglycemic patient is to raise the blood sugar levels back to normal, which in turn provides glucose to the cells for energy and normal functioning. If the patient has a good level of consciousness, so a GCS of 14 and above, with an intact gag reflex, you can give them something sugary to eat and to drink. Please ensure that you don't give the patient any diet drinks because these do not contain real sugar, so no Diet Cokes, but make sure that they have a full sugar drink. Make sure that you also follow up any sugary drink with something substantial for them to eat. Quite often when somebody has been hypoglycemic and they receive a sugary drink, the body chews up that energy really fast because the cells are starved of that glucose. So their blood sugar levels can increase while drinking that sugary drink, but they can drop very rapidly afterwards. And that's why we need to follow it up with some proper food. And then for any patient with a GCS of less than 14 with no intact gag reflex, we don't want to give them anything sugary to eat or drink because this increases the chance of them getting an airway obstruction. And what we need to do in these patients is manage the airway appropriately. This can be achieved by placing the patient in the lateral position, monitor their airway, breathing, and circulation until help arrives. The other medical emergency that can occur in diabetic patients is hyperglycemia, which can develop into a dangerous condition called diabetic ketone acidosis. Hyperglycemia results from an absence or a resistance of the tissues to insulin. Due to the lack of insulin, the glucose cannot enter into the body cells, and therefore there's a buildup of sugar in the bloodstream, resulting in the condition called hyperglycemia. Cells in turn become dehydrated and starved. The body then releases fats and proteins to be metabolized by the cells instead. Fats are more readily available to the body, so they're metabolized first. When fats are metabolized, they release fatty acids and glycerol, which can be used by the cell, and fatty acids get further metabolized to produce acidic ketones as a byproduct of cellular respiration. As these acidic ketones build up in the bloodstream and can't get eliminated rapidly enough either through respiration or urination, it results in a condition called metabolic acidosis, or diabetic ketone acidosis to be specific. This can result in severe electrolyte imbalances in the body and even cause life-threatening cardiac dysrhythmias. Common causes of hyperglycemia and diabetic ketone acidosis are inadequate insulin doses, failure to take insulin, increased dietary intake, the presence of an infection, or decreased physical exertion. And DKA may be the first presentation or sign and symptom that somebody's got diabetes. So this may be a person who has not been previously diagnosed with diabetes, and they present to the paramedics or the emergency room with the signs and symptoms of diabetic ketone acidosis with no previous history. Signs and symptoms may include diuresis, abdominal pain and cramping, nausea, vomiting, and anorexia, dehydration and dry mucosal membranes, warm, dry skin, cramps in skeletal muscle, an increased blood glucose level when you check it on the glucometer, acetone breath, so there may be a sweet or fruity smell on the breath, and in severe DKA, there may be labored breathing and gasping called Cushman's breathing. And treatment includes supporting the patient's airway, breathing, and circulation, optimize the oxygenation and ventilation, and transport these patients ASAP. Paramedics are not advised to administer insulin in the pre-hospital setting because of the likelihood of causing hypoglycemic episodes. So we never assist in administering insulin in the pre-hospital setting, but transport them rapidly to hospital where they can receive the appropriate care. Just some differentiation between hypo and hypoglycemia. With onset of the condition, it happens rapidly in hypoglycemia, but it happens very slowly and it builds up over time with hyperglycemia. Sweating may be profuse in the hypoglycemic patient. Just think diabetic shock or insulin shock, that's the other name for it. Whereas in the hyperglycemia, the patient's dehydrated, so they would have dry skin. Skin temperature, hypoglycemia, patient's going to feel cool to the touch due to the profuse sweating, whereas in hypoglycemia, they're dry and hot. Pulses may be normal in hypoglycemia, but rapid and weak in hyperglycemia. Blood pressures may be normal in hypoglycemia and decreased in hyperglycemia, if you think about the dehydration that's happening. When asking about history, you will most commonly find that in the hypoglycemic patient that there has been a missed meal, whereas with the hyperglycemic patient, there was no missed meals. When checking the blood sugar levels using a glucometer, in the hypoglycemic patient, you're always going to find lower readings, and hyperglycemia patients, you're going to find high readings. And in completion of our PowerPoint presentation, it is important to be aware that there are some long-term complications of diabetes. So with progression of the disease, there are major disturbances to the nervous system and the cardiovascular system. This may present in things such as cerebrovascular disease, retinopathy in the eyes, coronary heart disease and vascular disease, nephropathies of the kidneys, neuropathies, peripheral vascular disease in the lower limbs, and poor perfusion, which may lead to ulceration and amputations in diabetic foot. This concludes the PowerPoint presentation on diabetes.